Great. Literally, education means optimal guidance. And when we look at the outcome, the evidence that something substantial can be done for the well-being and the quality of life of people with autism spectrum disorders, one must face the evidence that only education has proved successful in enhancing the quality of life. So the topic of my presentation this morning shall be to kind of do a reconnaissance of the area of education, try to skew down on which themes should be addressed and how we can convey them. I have no financial disclosures, but I'm still involved in one random controlled trial on atomoxetine in ADHD and autism spectrum disorders. There's not much movement in my slides here. So could I have the second slide? Where do I? Oh dear. Excuse me. That's better. So what I'm going to do is I'm going to consider autism both as a developmental disorder but also in a developing perspective. And when it comes to education, it is to convey knowledge that we have on causes, on mediating factors, and we'll go into that to see that at the bottom line is that diagnosis, knowing the individual really well, is far more important than all the classification systems that have been regulating our services over the past 30 years. I must make it clear that I'm very, very pleased that DSM and ICD had good definitions and have good definitions of autism and of PDD-NOS and a less good definition of Asperger's disorder. But the fraud in the system is that many authorities think, oh, if you got that classification, these are your needs and that's what you're going to be entitled to get. And as we know, autism spectrum disorders are so different in their presentation over different individuals that we can never say, if you got an autistic disorder, you're entitled to have this. If you got PDD-NOS, you're entitled to have that. Because some people with autism need much more services than others, and some people with PDD-NOS need much more services than people with autism altogether. Then I'll go into the educational structure. Where do we target our educational interventions? And then I'll switch to French to say that it should be a process of éducation permanente. It's not psychoeducation that you give once. It's not solving the problems in toddlerhood. It's looking into the possibilities, the strengths and the weaknesses of the person with autism and its environment, its rearing environment, its family environment throughout life. And my last message will be that it's so utterly important to somehow, but anyhow, involve people with autism. You know, when you educate people in school or you educate them in any work setting, the biggest pitfall is to think for them instead of trying to take their perspective and know what they need. And in autism, many of us, parents, professionals, teachers, all together, we're always talking about the person with autism instead of trying to communicate with the person with autism, him or herself, in order to tailor a program that's really appropriated to the person's needs. What is important to keep in mind is that when I was on the board of the Netherlands Autism Association about 30 years ago now, in our country, the amount of people that had autism was 1 in 2,000. And 5 in 6 had a learning disability, had a mental retardation too. And that scope has changed tremendously. We're talking about 0.6 to 1% of the population, and the balance between those with learning disabilities and autism spectrum disorder and the high-functioning people with autism and the Asperger's has completely reversed. And in many parents' associations, that gives problems, because many of the people that have a long service duty are still from the old days when the mental retardation played such an important role, and it's very difficult to accommodate that. Luckily, we know that much more. There's an increasing knowledge on which are the causal pathways, though there's no cause that is known. It are really causal pathways, and I'll show you some of that evidence. But what is sure is that to date, despite all kinds of hopes that have been raised by different systems, there is no evidence for cure, in the sense that the autistic features really disappear. There's a lot of evidence for good guidance, for education, for care, and for increase of quality of life. When you look at the studies that Patricia Howlin did, and you see that in the 60s, 70s, 80s of the last century, 9 in 10 of the people with autism spent most of their life in institutions, there's a completely different picture nowadays, and the perspectives of people with autism and the perspectives for their families are far less gloomy.